How does that work? First of all, quite nice anti-curvature. I definitely enjoy the course because every year it's getting bigger and better. Now, over and over, we see people through the years coming back after a couple of years, learning about the updated techniques. So it's increasing the number of people who do osteotomies.
We can also appreciate the power of osteotomy. It's a big tool in my armamentarium when I get difficult cases.
Osteotomy is such a powerful and useful tool. The game changer has been a slick surgery, understanding the rehabilitation, having fixation methods and so on.
So the next case is a young woman who coaches basketball for a living. So what we did was went on to do a lateral osteotomy.
Well, specific to osteotomy, this is actually the best program I've ever been a part of. In terms of the depth of knowledge from our faculty members, I've learned a lot, and I've been around osteotomy for a lot of years.
The goal of the osteotomy is to unload the medial compartment, but without destroying the lateral compartment. Many years ago, when osteotomy was just designed to treat the osteoarthritis, it was then pushed away from the market by arthroplasty. But now I think we understand much more about the osteotomy.
Once you get familiar with them, they can become 45-minute procedures, really very straightforward. And a double osteotomy you can do comfortably in one tourniquet.
It is our frame put on to fix the plateau fracture.
I mean, it's been a superb 2 days. This is the 7th osteotomy course we've done. To have the view from North America, we had Bob Litchfield, the transatlantic view, we've never had that before, but also the European experts.
As Mike said, we've got the top guys in the world. I mean, really, that is Europe. That's where osteotomy is really happening. So to have, the kind of inventors of the new devices that we're using sitting teaching, it's fantastic.
The technique videos will be available on the website, which is a fantastic learning tool for people who've been on the course. But also, I believe most of the faculty are making their presentations available on that website as well, so people can digest.
And so after closure, it should be in the strong part of that plate. So you can use the plate to position your drawing. Here, just by looking in the sagittal plane, go parallel with the drawing. There's the test image pool, and double click on osteotomy, please. And there are some cases that are also in your 90 days trial, which you can purchase here for free after the digital planning, and you can work with. If you're there, you're going to move further. So zoom in, pan with the compressed right button of your mouse, right selector. After which you zoom out by going
Looked at our DVT, symptomatic DVT rate, it was 1.4% was what we had, was symptomatic DVT. So
do you give them any anticoagulants?
No, I tell them to take aspirin.
An osteotomy to offload the extensor moment helps that.
Bits of synthetic material to shove into the wrong joint. Yeah. The other thing, I was just on the subject, exactly the same subject you've been talking about.
Really? In fact, we insist on it. People often say to me, why are you doing x-rays? Just do an MR. And I say, no, it's not weight bearing in MR. You need the weight bearing film as well.
This course is very relevant for deciding on who to select an osteotomy for.
And have you found it worthwhile?
It's been great, actually. Really illuminating.
First year?
It's the first time I've been, yeah. And I think it's helped crystallise a few thoughts and what I might plan to do in the future, for sure.
Yes, I've heard about it before, and I've seen Adrian Wilson present at some of the conferences, but I've not been a beta test. The lecture's been very good, and the practical session was really useful.
I've already been on this course when I started my consultant career, and I've been doing a few. I don't do the numbers that these guys do. I do a few. I've come back to make sure I'm doing it the right way now.
Really an update on osteotomies. I do quite a few osteotomies already, and it's just nice to come back to this course every 2 or 3 years and see what's new and go through it all over again.
Right, so you've been before?
Yes, I've been on 2 or 3 occasions.
It's something I've got very little experience of, really, osteotomies around the knee, and but I recognise increasingly that there is groups of patients who really benefit from this.
Certainly it's up there with the best that I've been on so far. I've been impressed with the practical tuition we've had from the experts, and also the demonstrations have been very good indeed. I've been very pleased with the value of the course and the education content.